Last year, over 5.9 million people worldwide took a mental health screening through Mental Health America, with 78% in the U.S. showing moderate to severe symptoms.
As Mental Health Month kicks off tomorrow, this year's theme is Turn Awareness into Action. So we're joined by Mental Health America President Schroeder with more. Thanks for joining us. We appreciate you.
Hi there.
Thank you so much for having me, and thanks for your attention to this topic.
Absolutely. Very important topic here. So why don't you, in your words, tell us about Mental Health America Month?
Well, Mental Health America is the nation's oldest leading nonprofit focused on promoting mental health, preventing mental illness, and we do that through a variety of ways. We have over 140 affiliates across the country who are delivering direct services in their communities. And then we also have prevention programming, research programming, public policy work. You just mentioned our screening program, which is extremely important. We have a free and anonymous online screening resource where we are really able to keep a real-time pulse on the mental health of the country. We have over 16,000 people who visit it every day. And so we have a real sense, particularly with young people who are about half of the users, and we have a real sense of what's going on out there.
Yeah, wow.
You know, could you maybe break down why mental health is important right now and what's kind of going on with the state of mental health in our country?
Well, we have seen concerning signs about mental health in our country for a number of years. We see it through our own data, we see it through other data. Suicide has become a leading cause of death for youth. The opioid crisis and overdose and deaths of despair have been on the rise in recent years. So we know that we have an urgent situation on our hands. The good news is that we also know what works to address it. And we know that there is hope and there is help. At Mental Health America, we really like to start by thinking all the way upstream. In other words, how can we prevent these things from getting worse or happening in the first place? And our screening program, which you mentioned, is a really great place to start. It's a great place for people to start turning awareness into action, which is our theme for this month.
Yeah, absolutely. What trends are you seeing in your most recent data?
We're still looking at youth and despair and depression amongst youth. So as I mentioned, over about half of the people, the 16,000 people who are coming every day to our site, are under 18, and about half of those are telling us that they're having thoughts of suicide more than half the days. So this is enormously concerning. And we want to continue to track this and to help the country have a better understanding of what's going on in each area. Our screening program also has a mapping element so that if you want to look more closely at your state or what's going on locally with you, people are able to do that too and see the micro trends that you're asking about.
Yeah, important.
What would your message be to someone who is struggling with their mental health right now?
Well, that's probably the most important question. And to anyone who is struggling, what I can promise is that there is help and that there is hope. And that a great place to start is by having a conversation with someone you trust, someone who cares about you, or if you prefer and it's more comfortable, go to our website and take a screening test and then get some ideas for what you might do next to support yourself. But know that you are not alone.
Yeah.
These are very common.
Yes, for sure.
Thank you so much. And that website is where people can go for more information?
MHAnational.org.
Yeah, that's the place. Thank you so much for joining us and
me.
kind of putting a spotlight on this very important topic.
Thanks for having me.
Absolutely. Yeah, great to have that conversation and to know that there is help and there is hope out there.
Yeah, super necessary.
That's right.